Good evening, everyone. I'm feeling sort of embarrassed that I'm being included as one of the speakers because I am not a business executive. And I'm feeling very intimidated by everybody that was up here. But when I talked to John Teedstrom and he told me that the theme of this conference was defining forward, I was pretty thrilled. Because as Malva said, every day my organization focuses on what the future of global health will look like, and equally as important, who the future of global health progress will look like. When I was 21 years old, I was in college, and I had an incredible professor named Dr. Alvin Novak that I'm assuming some people in this room might have known. And he was one of those professors that just pushed me to think about my future and the future of the world. And he sort of represented everything great to me. And the next year, my professor passed away from HIV. And this was at Yale University. This was in the United States. This was in 2004, obviously when we knew how to prevent and treat HIV. And at this time, this was the same story for hundreds of thousands of people around the world who were dying from preventable and treatable illnesses because treatment eluded them. And that really infuriated me. I was an architecture major. And it made me become obsessed with global health issues. And it also made me realize that this continues to happen every day. So that still infuriates me. So my obsession grows. But the good news is that I am not the only person obsessed with these issues, as is testament to the fact that this conference exists. Over the past several years, my generation has gotten increasingly obsessed with these issues. Organizations like the One Campaign and RED and Kenneth Cole Ads have piqued the interest of literally hundreds of thousands of young people that want to work on these issues, which is a pretty great opportunity. That's good news for me, and that's good news for everyone in this room that's hiring people in my age group. So in 2009, I met some business partners, two guys that were working at Google, and two guys working at a college advocacy organization called Face AIDS. And we started Global Health Corps, and we actually started it to take advantage of the fact that so many people in our generation were engaged. So what we do every day is we mobilize outstanding recent college graduates and young professionals from around the world to serve for a year in global health. We partner with outstanding organizations like Mothers to Mothers, who was just up on this stage, Partners in Health, Clinton Health Access Initiatives. Our partners identify an area of need, and then we recruit young leaders to work for them for a year filling this gap. Our fellows always work in teams of two, so there's always one fellow from the country where they're working, partnered with international fellow. And this means that we are working with a truly global group of young leaders that are focused on global health issues. It's been pretty amazing because our generation grew up completely global. I know this week a lot of people were saying we're living in a global world now. We never knew not living in a global world, and we never knew not living in a connected world. And so our fellows bring a very different skill set and awareness to the jobs that they do. So our fellows work for a year, and then throughout the year we provide professional development and mentorship and training for them, because we're not only investing in what they're doing in this year, we're investing in what they will do as leaders throughout the rest of their lives. And we've been really lucky to work with several of the corporations in this room that are bringing their support to us, but more importantly, the knowledge that they have to our fellows. Our fellows are all under 30. They're all closer to the beginning of their careers, so they can learn a lot from an executive at HP that has a supply chain background. They can learn a lot from a technology professional from Cisco. So we've been thrilled to already be able to allow our fellows to have a dialogue with corporations that have very tangible value adds to global health. Since we started in 2009, we've placed 126 fellows in East Africa, Southern Africa, and the United States, because in case you didn't know, we have global health issues here. And our fellows have been from 11 countries. So you might wonder what we think a young leader in global health looks like. Well, they look actually really similar to what a lot of your employees and colleagues look like. One of our first fellows was named Amit Salvi, and Amit was 26 when I met him, and he was working for the Gap in California. And I just knew he was going to be a global health professional then. But Amit applied to join us, and 2 months later, he was working for the Clinton Health Access Initiative in Tanzania. And what he was doing there was he was working for the 1 million people on the island of Zanzibar, doing the same thing that he had been doing for Gap customers, except this time he was not working on a jeans supply chain, he was working on a drug supply chain. So every day he focused on making sure that drugs were leaving warehouses and getting into clinics, and more importantly, from those clinics, getting into the hands of the patients that need them. Amit completed his fellowship a year ago. He's now doing the same thing in Kenya. Amit is joined by another one of our fellows in this room named Hezekiah, who is a Nigerian MBA. He's working every day in Newark, New Jersey on a community health literacy program, making sure that the patients that come to hospitals understand the issues that they're dealing with. He's joined by 4 Rwandan architects that are working with the Ministry of Health to design hospitals so that airborne illnesses don't spread to anyone that enters. He's joined by educators. He's joined by people with computer science backgrounds. He's joined by 126 fellows, some with very relevant medical backgrounds, but many with very relevant business backgrounds. And these 126 fellows will be joined by 90 new fellows in July. Those 90 fellows were chosen from over 5,000 applications, which makes me really hopeful that my generation is going to step up to the plate and deal with these health challenges. And these 126 fellows represent to me the powerful notion that young people can make an enormous impact in the field of global health now, while continuing to work on these issues for the rest of their lives. I noticed today that one of the milestones for one of the goals was 2032, and I know how old I'm going to be in 2032. And that makes me pretty focused that I'm making sure that a lot of other young people are coming to this field so that we can actually reach that milestone. So the reason that I bring this all up to y'all is because I just want to make sure that every company in this room realizes the incredible talent that they already have, or the incredible talent that they have coming to interview for them. I know that in 5 years, I won't be the one standing on this stage. One of our fellows that is the Minister of Health in their country will be standing on this stage talking about what they're doing. And I hope that everyone here in your companies, you're thinking about who you want standing on this stage in 5 years, representing you and the enormous impact that you're making in global health. Dr. Agnes Benawahu, who's the Health Minister of Rwanda, is one of my greatest mentors, and she told me once that she loves Global Health Corps Fellows because they don't represent business as usual, they represent business as unusual. And I think the reason that everyone here today is because they believe in business as unusual. So I just really want to push all of y'all to make sure you're not wasting any incredible talent that can make an impact on saving lives and changing lives and reaching these goals that we've talked about today. So thank you so much for having me today. It's been lovely to see all of you.